A helpful way to avoid COVID-19 at the gym. A lot of my clients have reached out to me and saying, Bill, we're bored. We want to go to the gym. We want to exercise. We need to get out. And I say, you can get out and you can go exercise, but let me share some information with you. The gym and COVID-19. A new study offers a strong reminder that COVID-19 and the gym don't blend especially right. Indoor group fitness training are simply a powerful way to transmit the coronavirus, consistent with the two new research from the Centers for Disease Control and Prevention. Both the research checked out COVID-19 outbreaks that took place at fitness centers throughout the summer of 2020, along with one bike and spin class wherein every participant ended up sick. Every participant ended up sick. The outbreak turned into detected in the gym by the Department of Health Investigation. For the research, contract cases and case investigators related 21 instances of COVID-19 to two health teachers who taught several instructions in June and July 2020. They taught even though they'd been infected, however, before they had major symptoms. So they could look perfectly healthy. But if they're not wearing the mask and they're not socially distancing, keep away from them. The instructors did it. Yeah, the instructors did it. One of these instructors taught a 60-minute high in-depth class, biking class, simply 4 hours before his signs and symptoms appeared later that night. The teacher and college students have been all stationed at least 6 feet apart. However, none wore their mask at the same time as operating out in step with the gym's protocol. And the gym windows and doors had been closed. The teacher was instructing the class, shouting instructions and encouragement. The record says, and probably spreading infectious respiration droplets containing the virus. Over the next week, all 10 people who attended the class tested positive for COVID-19. So you wonder, how do you get it? Enclosed spaces, people not wearing their masks, not spacing apart. Of these infected individuals, one was a health instructor who was later to be admitted to the ICU for extreme case of COVID-19. And if you saw what damage the COVID-19 does to a person's body, especially their lungs, you'd be horrified. But earlier than this, his science assistants came on. He taught more than one training unmasked at a different facility, such as a non-public education consultation and three small kickboxing classes just 12 hours before his science assistants regarded. Of the 11 folks who had been exposed that day, 5 of whom were additionally uncovered to the trainer 2 days earlier. 10 would positive for COVID-19 over the following couple of days. The students who did wear masks and one of the teacher's 4 private education clients the day prior to this also got the virus. So it's very dangerous. Location, location, location. Another CDC researcher had a look at checked out classes connected to a fitness center operating at 25% capacity during the last week of August 2020. That's 25% of capacity. Out of 81 individuals who attended excessive in-depth instructions that week, with most going to most classes, 55 could be recognized with COVID-19. Participants had their own mat and weights, underwent system screening and temperature checking on arrival, and maintained 6 feet of distance. However, were not required to put on masks while training. Out of the 58 respondents, 76 reported they wore their mask occasionally. Perhaps extra startling, 22 attendees who got COVID-19 went to a class on both the identical day or after the symptoms commenced. 3 more went to all classes that day or upon getting a class took a look at each result. But it's feasible that a few could have gone to the training that day before noticing signs and symptoms later in the day. Neither report is shocking. Given what we realize the spread of COVID-19, the Health Club makes it an ideal location. In both case studies, public health professionals found that a mixture of poor mask use, excessive respiration exertion, loss of airflow in an enclosed area, and extended close touch have been a few of the likely elements facilitating transmission. All of that strands up with what we already realized about the coronavirus, which spreads mostly through respiration droplets. So, what is the safety at the gym? The most secure way to exercise during the pandemic to be indoor or outdoor by yourself or members of your household, and despite the fact that the threat for exposure from attending a fitness class with other people will not be totally safe, it's possible to make the situation safer by way of shifting it outdoor, or in another case, making it sure enough airflow, and ensuring everyone use right bodily distance and wears a mask. Get the temperature check, social distancing, and everybody wear a mask. And everybody use the hand sanitizer that's available at the gym. But my recommendation to you, exercise at home, take walks, take vitamin D, and keep your spirits up, and get sunshine, and get out of the house. Because not only getting out of the house is good for your body, but it's good for your mind. Confused about Medicare? What's Part A? What's Part B? What's Part D? What's Part C? What are the Medicare penalties? What are the Medicare deadlines? Go to our free daily Medicare educational webinar and get all your answers to what you need to know. Go to seniorhealthcorp.com and register to get on the webinar. See you there. Go to our website, seniorhealthcorp.com. My name is Bill Vargas. I'm an independent Medicare agent. My company name is Senior Health Corp. We serve the health needs of seniors and veterans. We take all the confusion out of Medicare and get you the best possible policy for the lowest possible price. So go to our website, view our daily free Medicare educational webinar, contact us, and we can help you get the best for the less. Take care. Bye-bye.